immunologist at the Jackson Laboratory. Derya, really great to have you back. Let's just start with these latest developments on how cases can be transmitted with patients that are asymptomatic. What do you make of it, and what does this do in terms of mixed messaging that people are getting on how COVID-19 is spread?
So first of all, this was another disastrous announcement or statement from WHO. It's actually one of the several. They have made the same claim several months ago that when the transmission first started, that they weren't even sure that there would be a human-human transmission. Just recently, they agreed that masks are useful. I mean, this is WHO, which is responsible for the health of the whole world. So they have to be extraordinarily cautious about their statements. Now, in regards to asymptomatic spread, we know that it happens. I mean, this is clear. The question is what proportion or what percentage of the asymptomatic individuals are the true spreaders remains unknown, because this is extraordinarily difficult experiment to do. Some say maybe 10%, some say maybe 40%. But regardless, a portion of those people who show no symptoms whatsoever have the capacity to spread the virus. There's absolutely no question about that. So when you make a statement such as this, it gives a false sense of security to people. If there's no symptom on the person in front of me, then I don't have to wear a mask. I don't have to keep my social distance. And this is exactly how this virus actually spreads. So it was very unfortunate. And I think they tried to correct it afterwards, but it was a bit too late.
Derya, all this is happening at a time when we knew that a second wave was possible, or a second peak was possible as states reopen. We are seeing cases rise in almost 24 U.S. states. That's inevitable when you talk about easing those social distancing and lockdown restrictions. But I think a lot of us are wondering, with these large-scale protests that we've seen across the nation, what are we in for when the data starts to reflect the protests that we've seen across the country, and just Americans enjoying their summer and going out more in the weather, which we've seen?
I mean, I think we are beginning to see the result of that in certain states. I think some of the inland states in the U.S., Florida, Texas, Arizona, California, Utah, there's a significant spike in the number of cases. And this will continue to happen. Actually, just two papers came out in Nature, which is one of the best journals in the world, scientific journals. These were models, which what they found was that if there were no lockdowns, if there were no preventions, such as the ones that we have undergone through, there would be 60 million more people infected in the U.S. alone. And they calculated that probably it saved about 3 million lives in the last couple of months. So we know what would happen if we do not take precautions. Obviously, lockdowns are not sustainable, but it's extraordinarily important that the social distance and the masks and being extraordinarily careful in closed environments, and to do this in a phased manner. You can't just open up. And as you pointed out, I mean, the protests couldn't have happened in the worst time. There will be a cost to pay for that, unfortunately.
And one more quick question, Derya, before we have to pivot to some other news. There are reports within the government that the drug remdesivir that has been used to treat COVID-19 patients is going to run out at the end of this month. What are the potential implications there?
Yes, I saw that news today, and frankly, I was a bit surprised. I mean, this is the only drug that has been shown to work in a randomized trial. I mean, there are many other trials ongoing. One would imagine that the company would make sure in every possible way to produce or to increase the production capacity To say that this is going to run out then at the end of this month is a bit shocking, I have to say. I don't know what would happen. It doesn't necessarily reduce the mortality very much, but it is quite effective in reducing the hospitalization. And probably, if it was used early enough, it could even have an effect on mortality because it really stops the virus in laboratory tests. It's quite a potent drug. It's quite unfortunate, but they did mention that they're trying to remedy the situation.
Dr. Unutmaz, we really appreciate your analysis and expertise as always. Thanks for that.